Coronary artery disease is often develops silently over years, decades, and the first symptom in some people is, sudden death. Let's explore why that happens. Let's break it down. So, coronary artery disease, also called ischemic heart disease, the same thing, occurs when the coronary arteries, which supply blood oxygen to heart muscle, myocardium, become narrowed and blocked due to atherosclerosis. Actually, it's the beginning of metabolic syndrome. This is the gradual buildup of cholesterol, inflammatory cells, and fibrous tissue forming what we call plaques. But here is the twist. Most heart attacks don't occur because of a large, stable blockage. No. We used to talk about that, yes. They actually happen when a small unstable plaque suddenly ruptures, triggering a blood clot, thrombus, that completely blocks the artery. This means a person may have only 30, 40, even much less, narrowing, so not enough to cause a chest pain during exertion, during exercise, yet still suffer a fatal heart attack if this plaque ruptures. So that's why coronary artery disease is sometimes called silent killer, an absolutely correct name. Now, what makes this especially fascinating is that the process begins years, I repeat, or even decades before symptom appears. So endothelial dysfunction, so actually it's the beginning of metabolic syndrome, it's inflammation, endothelial dysfunction, the earliest step in atherosclerosis. Atherosclerosis also is a part of metabolic syndrome. So it can be detected even in teenagers, this endothelial dysfunction, with risk factors like smoking, obesity, and the most important, lack of physical exercise, physical activity, regular physical activity, hypodynamia. By the time someone develops angina, chest pain, the disease is already well advanced. So clinically, coronary artery disease can present as stable angina and all spectrum of acute coronary syndrome, unstable angina, myocardial infarction. Diagnosis relies on ECG, cardiac enzymes, especially troponin when we've got a myocardial infarction, echocardiography, and imaging like coronary angiography. And treatment focusing on the prevention, beginning of the all beginnings. So it's a prevention. No intervention. So about prevention, it's what is this? Lifestyle changes, no smoking, regular physical activities, about medications, aspirin, beta blockers. I don't want to talk about statins. So coronary artery disease doesn't just block arteries, it hides in a plain sight, evolving quietly for decades until one unpredictable moment changes everything. Get it? Stay blessed.